Dr. Anthony Fauci says the U.S. is, quote, on the brink of a coronavirus surge. Cases have been on the rise for several weeks as the more contagious variant first found in the U.K. spreads across the U.S. Total infections now stand at more than 30.8 million, and more than 556,000 lives have been lost. As of Tuesday morning, 19% of the population had been fully vaccinated. That is more than 63 million people. Nikki Battiste reports from New York City.
New York, now one of 31 states vaccinating people as young as 16.
We will not get to the point that we have enough people in this country immunized unless children are immunized.
As vaccines ramp up, some colleges are cracking down. At least 8 now making vaccines a requirement for kids returning to campus this fall. And an immediate concern as restrictions are relaxed, more mass celebrations.
And now, ladies and gentlemen,
At Tuesday's opening day for the Texas Rangers, a packed ballpark.
When you see those images, how concerning are they?
We're spiking the ball on the 5-yard line. We're not quite out of this yet.
Cases up at least 20% in 9 states, coast to coast. The variant first discovered in the UK is now in all 50 states.
It's more transmissible, it's higher morbidity, higher rate of hospitalizations, and causing a lot of young adults to get sick.
Despite that, California's governor setting an ambitious goal to open that state entirely by June. And tonight, experts are sounding the alarm about COVID survivors. The American Heart Association now warning the pandemic could unleash a tsunami of chronic health conditions that could worsen hypertension, diabetes, and heart disease, all making the vaccine rollout even more critical. This moment could not come fast enough for 16-year-old Brianna Justice, who is living with sickle cell anemia. What does this vaccine mean to you?
I do wish that I would have gotten it sooner. I was constantly sad. I was depressed. I never want to feel like that again. I never want anybody to feel like that.
Here at Lennox Health Greenwich Village in New York, about a dozen teens got their first Pfizer dose today. But a new study shows parents across the U.S. are still divided. Half say they're hesitant to have their child vaccinated. Elaine?
Nikki Battiste, thank you. For more, let's bring in Dr. Amesh Adalja. He's an infectious disease expert and a senior scholar at Johns Hopkins University's Bloomberg School of Public Health. Welcome, Doctor. Good to see you again. So Dr. Anthony Fauci says that we are, quote, on the brink of a surge as variants continue to spread. Can we still avoid a 4th wave, and how much work lies ahead before we can make a dent in this pandemic?
Well, I think that now with this 4th wave, we actually have the solution at hand, because we know that putting vaccine into people is the best way to get cases down. And when you look at where cases are occurring, they're occurring in people who haven't had access to the vaccine. So as we see more people become eligible for the vaccine, we will be able to blunt the effects of this 4th wave. But our 4th wave is going to be very different than prior waves, because we've done so much in terms of vaccinating high-risk individuals, nursing home residents, that we don't really have that same linkage between cases and hospitalizations. There's been a decoupling because of how we've basically prioritized our vaccine. So that's going to be something very different from earlier waves. And I think that's something that I think we can be optimistic about, that we've sort of tamed this virus through the use of the vaccine.
Well, as we heard, President Biden wants states to make all adults eligible for a vaccine by April 19th. That is less than 2 weeks away. How big of an impact will this have on our country's vaccination efforts?
I think it's a major impact. We really want to start moving away from the priority groups and moving to kind of a mass vaccination mindset, because the more people that get vaccinated, the quicker we'll see cases go down, the quicker we'll end this public health emergency. And I think we've had a lot of missteps when it comes to the vaccine rollout. It's getting better. And I think now we're at a point where we're not necessarily supply constrained. So I do think that increasing eligibility, getting a vaccine as easy to get as a flu shot, I think that's the way we want to go. And I'm thinking that once more people get vaccinated, we will start to see cases go down once we sort of hit an inflection point where enough of the population has been vaccinated.
Well, the U.S. has administered 150 million coronavirus vaccine doses in President Biden's first 75 days in office. What are some of the obstacles that we still face in this process?
Well, right now it is still difficult to get a vaccine. You might have to open up several different web browsers. You might have to look around as if you're looking for concert tickets, and that's not what we want people to do. We want people to be able to just go and get a vaccine. So that's been one difficulty. As we get more supply, we are going to run into also vaccine hesitancy. We're going to have to persuade people who are unwilling to get the vaccine that this is a safe and effective vaccine and that it will improve their lives. That's going to be another challenge as more vaccine rolls out. And I think, that's the big challenge that we have, is trying to put this pandemic behind us when we've got such a great solution, and making sure that people have access to it and want to get it.
Well, a CDC study found that many children who developed multi-system inflammatory syndrome after contracting COVID had no COVID symptoms. Instead, they developed that rare condition 2 to 5 weeks later. Is this surprising, doctor? What have we learned about this condition and how it develops?
There still are a lot of mysteries about multisystem inflammatory syndrome. We don't quite know exactly what puts a child at risk for it. And we find that it sort of appears to be like certain autoimmune diseases, like Kawasaki syndrome, where children may have a mild or basically unnoticed respiratory illness, and that sets off a cascade of physiological changes that leads to multisystem inflammatory syndrome. And I think this is going to be one of the most pressing research challenges, is to try to understand which children are at risk and how to predict it and how to prevent it and how to treat it. And as we get more children vaccinated, I think this is another reason to get children vaccinated, actually, because there is this severe consequence that certain children have that we don't quite understand.
All right, we'll continue to watch that. Dr. Amesh Adalja. Doctor, thank you very much.
Thank you.